If you have been told that you have a thyroid nodule and you are exploring your options, you may have come across a treatment called radiofrequency ablation. This is often shortened to RFA. You might be wondering whether it is right for you, what actually happens during the procedure, or whether it is as safe as people say. I want you to know that many of my patients have found real relief through this treatment. They experience less pressure in the throat, more comfort when swallowing, and peace of mind knowing that their thyroid gland is preserved. Today, I will walk you through everything you need to know about this non-surgical thyroid treatment from start to finish so you can feel informed and confident about your next steps. Let us begin with what radiofrequency ablation actually is. Radiofrequency ablation is a minimally invasive treatment designed to shrink thyroid nodules without removing the thyroid gland. I often explain it this way. Instead of surgically removing part of the thyroid, we treat the nodule from the inside in a controlled and targeted manner. The word ablation simply means that we treat a specific area so it stops functioning. Over time, the treated nodule becomes smaller, pressure and discomfort improve, and any visible lump in the neck becomes less noticeable. All of this happens while the thyroid gland itself remains intact and continues to function normally. So how does this shrinking actually occur? During the procedure, we use ultrasound imaging to guide a thin, needle-like probe directly into the thyroid nodule. This probe delivers carefully controlled heat to the tissue. The heat stops the treated cells from functioning, and over time, the body gradually clears away that tissue. It is important to understand that this is not an instant fix. The nodule does not disappear immediately after the procedure. Instead, the body slowly remodels and absorbs the treated tissue over several months. Most patients notice the greatest improvement within the first 3 to 6 months, with continued reduction for up to 1 year. On average, thyroid nodules treated with radiofrequency ablation shrink by about 50 to 80% of their original size within 12 months. This is a meaningful reduction that most people can feel and often see. One of the most common questions I hear is whether radiofrequency ablation is the same as thyroid surgery. The answer is no. They are very different. Radiofrequency ablation is a procedure, not a traditional operation. There is no surgical incision, only a tiny needle entry point. The procedure is performed under local anesthetic. This means we numb the skin and the area around the thyroid while you remain awake and comfortable. Because no thyroid tissue is removed, the chance of needing lifelong thyroid hormone replacement is extremely low for benign nodules. In contrast, even when only half of the thyroid gland is removed during surgery, there is about a 1 in 5 chance that the remaining thyroid will not produce enough hormone. This can result in the need for daily medication for life. It is important to note that radiofrequency ablation is not suitable for every thyroid nodule. Nodules that are mostly fluid-filled cysts often respond better to a different treatment called ethanol injection. Radiofrequency ablation is considered the preferred treatment for solid or mostly solid benign thyroid nodules. Benign means non-cancerous nodules. Now, let us discuss who is a good candidate for radiofrequency ablation. This treatment is generally considered for people with nodules that are confirmed to be benign but are causing symptoms. These symptoms may include a persistent sensation of a lump in the throat, discomfort while swallowing, or cosmetic concerns when the nodule is visible. If a benign nodule is not causing symptoms, careful observation is often the best approach. We do not perform radiofrequency ablation without a clear reason. The goal is to improve quality of life. Safety is always the top priority. The most important step before performing radiofrequency ablation is confirming that the nodule is truly benign. This is usually done using a fine needle aspiration biopsy, commonly called an FNA biopsy. For solid nodules, many specialists prefer to have two separate benign biopsy results to be completely confident. If a biopsy result appears benign but the ultrasound features look suspicious, we pause and reassess. Proceeding without full diagnostic confidence is not acceptable. Before the procedure, we also review blood tests, especially the thyroid-stimulating hormone level, known as TSH. If a nodule is overproducing thyroid hormone, sometimes called a hot nodule, radiofrequency ablation may still be an option. However, hormone levels are monitored more closely afterward. We also carefully review medications. If you are taking blood thinners such as aspirin or warfarin, do not stop them on your own. Always inform your medical team so a safe, individualized plan can be created. Now let us talk about what the procedure experience feels like. Radiofrequency ablation is performed as a day procedure, meaning you go home the same day. You will lie on your back with your neck gently extended. Several safety techniques are used throughout the procedure. One is the moving shot technique, where the nodule is treated in small sections rather than all at once. The probe is internally cooled with chilled saline to keep the heat precisely controlled and protect surrounding tissues. Another important safety method is hydrodissection. A small amount of sterile fluid is injected around the nodule to create a protective fluid layer. This gently moves important structures, such as nerves, away from the heat zone. During the procedure, you may feel pressure, a deep aching sensation, or warmth in the neck. Some people notice a sensation in the jaw or ear. This is normal and occurs because of shared nerve pathways in the neck. Being awake during the procedure is actually a safety advantage. It allows real-time monitoring of your voice and comfort. After the treatment, gentle pressure and ice are applied, and you are observed briefly before going home. If you are finding this information helpful, consider subscribing to the channel. I regularly share patient-friendly guides to help you understand and manage thyroid conditions. Most side effects after radiofrequency ablation are mild. These may include temporary soreness or minor bruising that settles within a few days. Serious complications, such as permanent voice changes or significant bleeding, are rare and occur in fewer than 1% of cases. However, you should seek urgent medical care if you experience rapidly increasing neck swelling, difficulty breathing, fever with neck pain, or a new voice change that does not improve. These situations are uncommon but important to recognize. Recovery after radiofrequency ablation is usually quick. Most people return to work the next day. Heavy lifting and intense exercise should be avoided for a few days to reduce swelling and support healing. Follow-up is an important part of treatment. Ultrasound scans are typically performed at 3 months, 6 months, and 12 months to assess nodule shrinkage. Regrowth can occur, but it is uncommon and usually seen in very large nodules. If regrowth does happen, radiofrequency ablation can often be repeated. Choosing this treatment does not prevent future surgery if it is ever needed. Radiofrequency ablation offers a thoughtful and minimally invasive way to reduce symptoms while preserving the thyroid gland. If this video has been helpful, please like and subscribe for more clear and practical thyroid education. If you have questions about your own situation, feel free to leave them in the comments. I read them and address many in future videos. Thank you for watching, and I will see you in the next one.